And then somewhere in early 2021, when the vaccines were rolling out, doctors in this group started to say, hey, I'm seeing adverse events and I think they're real. And as soon as someone opened that up, there was a flurry of adverse events reported by physicians from their patients and themselves.
What do doctors as a whole truly think about COVID? We often hear that those who dissent in their views represent a fringe group, but is that really true? As a journalist, I had spent a lot of time talking with different doctors and scientists about COVID, most of whom had slightly different perspectives, but generally felt the mainstream narrative was overly simplistic or in some cases outright wrong. But why did so many doctors disagree with one another? Were all of them exploring the same information? Who were they deciding to trust and why? I'd been wanting to understand this cultural phenomenon for over a year. A friend of mine, Dr. Madhava Setty, recently wrote about his experience with this. Madhava is a physician you've likely seen a lot on this channel. We've been breaking down and exploring much of the data that has come out over the last 2 years about COVID-19. During COVID, Madhava was invited into a group of over 20,000 physicians and medical professionals who were uniting in good faith to discuss what was going on with COVID. Perhaps it was through what happened in this group that we can understand why there was such a divide amongst doctors during COVID.
The reason why these groups formed, and this is not the only one, was for doctors to educate each other on what was going on. What is the current science? How are you treating patients? What should we be aware of? What are things to avoid? So it was a very useful means of sharing information at a time where there was no information. And we generally say, oh, well, science is dead and doctors are evil and pharma's evil and nobody's listening. It's like, yes, I can understand that perspective, but in order to get a better understanding of what is going on and how to fix it, we have to look at the etiology or the unfolding of this phenomenon. And that's what I hope to offer.
If mistakes were made during COVID, we need to know what happened so we can bring about solutions so we don't make the same mistakes again. If there was an effort to cover up facts on the part of health authorities, we must understand that as well. So I asked Madhava what the experience inside the group was from some of the doctors who were experiencing COVID on the ground. To be clear, COVID hit in the US in March 2020, but Madhava joined the group in December of 2020. Out of curiosity, he went back into the group's history to understand all that had been discussed through the course of this pandemic.
And what I saw back then and what I outlined in the piece was a very poignant and direct, long post from a physician, an emergency room physician in an undisclosed part of the United States that talked about what he was seeing, and he painted a very dire picture. And we have to remember that at the time, doctors didn't know what to do. There's no guidance. There wasn't even enough PPE, personal protective equipment, to go around. And we had this disease that was lethal in some situations. There was no treatment and no guidance. And when this person early on talked about what he was seeing in an emergency room, I could totally understand how physicians who were reading this would say, holy moly, what are we going to do when it comes down to our ER? It's just a matter of time. And so, and I think you specifically, Joe, can really understand what this means because this is trauma. These doctors were being traumatized.
I am an emergency room MD. Every one of my colleagues have now seen several hundred COVID-19 patients, and this is what I think I know. Clinical course is predictable. 2 to 11 days after exposure, flu-like symptoms start. Common are fever, dry cough, myalgias, nausea without vomiting, abdominal discomfort with some diarrhea, loss of smell, anorexia, fatigue. Day 5 of symptoms, increased SOB, and bilateral viral pneumonia from direct viral damage to lung parenchyma. Day 10, cytokine storm leading to acute ARDS and multi-organ failure. You can literally watch it happen in a matter of hours. 81% mild symptoms, 14% severe symptoms requiring hospitalization, 5% critical. China reported 15% cardiac involvement. I have seen COVID-19 patients present with myocarditis, pericarditis, new onset CHF, and new onset atrial fibrillation. I undress in the garage and go straight to the shower. My spouse and kids fled to my in-laws' home. The stress and exposure at work, coupled with the isolation at home, is trying. But everyone is going through something right now. Everyone is scared, patients and employees. But we are the leaders of the emergency room. Be nice to your nurses and staff. Show by example how to tackle this crisis head on. Good luck to us all. So looking at those quotes, like of what he was talking about, there's thinking back to the early days, right? You had this some nurses are dancing because their ER rooms are empty, while other nurses are like, they literally have like indentation of the masks and the stuff because it was on their face so much, and they were exhausted and they were sleeping, in little cubby holes in these different areas trying to get rest. They were so inundated. And so there was this mix of, is COVID really that widespread and serious? But, some areas it's empty, in other areas it's a huge problem. The sentiment in that group, was it clear that it was widespread? Was this guy's, story something that was rare and unique, or was this happening throughout? What was it from what you saw?
Well, this is where we get into a very interesting aspect, which is who is motivated to report. And I would say that the physicians who were actually dealing with a real-time crisis that blew open their ICUs and emergency rooms were reporting on it, whereas doctors who were sort of saying, "Well, it hasn't happened here," wouldn't say anything. And it's reasonable to say that this was not happening across the country, as our mainstream media sources were suggesting. But let's be very clear, that doesn't mean that it could not happen eventually. So I would say that physicians and people part of this group realized that this was a possibility that could occur at any time. And that is what, colored the lens through which they were listening to people's information. It's like, look, it's happening. And I wanted to say one thing. That particular physician that talked about what they were seeing in the emergency room, they were very accurate. They were talking about things that I totally will get behind. That's how it presented early on. And I have no question that this person was being completely forthright forthcoming in describing what he was seeing. He was not exaggerating.
Hearing about this makes one wonder, is this more severe than a flu season? We now know that not all hospitals were experiencing this level of pressure. Some experienced very little. But why were hospitals so unprepared for this? Is this then more extensive than a bad flu season, or is this about a bad flu season? Where can we sort of tie that in for people? Like, how does that feel from what we saw there?
It was much worse. According to this doctor, it was much, much worse because, young and old in his experience were succumbing to the disease and dying. And even in a bad flu season, there are remedies around. It's the flu. We know what to do. It's supportive care. In very, very difficult situations, people have to be intubated and put on a ventilating, a breathing machine. But in this situation, as we found out later, that particular intervention was deleterious to patients. So this is not a typical flu outbreak. And moreover, this doctor specifically said that he was discharging people home with multifocal pneumonia, which means like a large, part of your lung field is infected. He was discharging people to home with oxygen. These are usually indications that the person needs to be hospitalized, but they just didn't have the capacity to do that. So he was like letting people go, saying, look, I need a bed and there are sicker people than you. So I have to discharge you in order to free up another room for someone who was about to die. So not the same.
So to some of the doctors in this group, we get a sense that in the early months of this pandemic, it was something that they did not know how to deal with and they had not quite seen before. But there was an open inquiry and curiosity into understanding how they could treat their patients to the best of their ability. Thankfully, it wasn't long before we began to hear about treatment options.
We're here because we feel as though the American people have not heard from all the expertise that's out there all across our country. We're America's frontline doctors. We're here only to help American patients and the American nation heal.
I'm here because I have personally treated over 350 patients with COVID. Patients that have diabetes, patients that have high blood pressure, patients that have asthma, old people. I think my oldest patient is 92, 87-year-olds. And the result has been the same. I put them on hydroxychloroquine, I put them on zinc, I put them on Zithromax, and they are all well. For the past few months, I've taken care of over 350 patients. We've not lost one. I'm upset. Why I'm upset is that I see people that cannot breathe. I see parents walk in, I see diabetics sit in my office knowing that this is a death sentence and they can't breathe. And I hug them and I tell them it's gonna be okay, you're gonna leave. And we treat them and they leave. None has died. So if some fake science, some person sponsored by all these fake pharma companies comes and say, oh, we've done studies and they found out that it doesn't work, I can tell you categorically it's fake science. This virus has a key. It is called hydroxychloroquine, zinc, and Zithromax. All you fake doctors out there that tell me, oh yeah, I want a double-blinded studies. I just tell you, quit sounding like a computer, double-blinded. I don't know whether your chips are malfunctioning, but I'm a real doctor.
Upon hearing about these treatments, the physicians group did not breathe a sigh of relief. Instead, they went on the attack. Thoughts about how to combat the America's Frontline Doctors press conference video that has gone viral, basically claiming that they are using hydroxychloroquine and zinc to cure and prevent COVID-19, and scientists are lying about it not working and not being safe? So frustrating. They lost me right at the beginning. None of them have masks. It's really sad to see how easily propaganda thrives in our social media environment. They need to be discredited. They're not acting responsibly. They are not advocating for a treatment that needs to be looked at legitimately. They're claiming to have a cure that is being denied from the general public by mainstream medicine and science. They are literally trying to discredit the rest of us. How are these real doctors not under board review for spreading such misinformation during a pandemic? The Texas Medical Board should pull her license. All of the physicians in the video who have active licenses should have them revoked. Now, to be fair, here's where things get a little bit tricky about the way this America Frontlines doctors press conference might have been perceived by doctors watching at home. You have one doctor who's getting quite passionate about what she is seeing and what she's doing, and the way some of her words come out, it could be offensive to some of the doctors at home that are sitting there going, well, I'm not using any treatment, and the way you're talking to me is as if you're attacking me for not believing the treatment that you're using. But at the same time, this particular doctor has been gaslit by legacy media and by government and by pop culture, literally telling her that I know what you think you're doing is working, but it actually isn't, regardless of the fact that you've been treating 350 patients with it. So there wasn't any real science to say that what she was doing wasn't working, because later the science that initially said hydroxychloroquine it has no use was retracted due to data inaccuracy. So to me, her passion and frustration is understandable in this case, but I can also see how it created a bit of a cultural rift within the doctor community.
It's hard to really put your mind around it, honestly, as a physician, especially as doctors who were looking for some way of helping people. And then you have colleagues who are saying, look, we found something that helps. And then to see this entire group like attack them as pariahs for offering a solution, and that's where things just didn't make any sense anymore. It's almost as if doctors couldn't believe that something so horrible could be treated with a dietary supplement and a drug that we've known about for 50 years. Like, that was almost incomprehensible to physicians. And that's part of the reason why they went to an irrational response. Like, who are these people? This is ridiculous that they're offering a treatment. Yeah. Which doesn't make any sense.
Yeah. And so there's a number of comments that are being exchanged here and there. People, there's no way these people are being irresponsible. Different sort of attacks are being thrown at these doctors who've come out and said this. And there's also this demand for we need double-blind placebo-controlled studies on this, before we can consider it. Why that in a time? Is that normal to ask in a time of crisis where we're looking for solutions?
That's a good question, Joe. And and sadly, there's not a yes or no question answer to this, because it is a rational thing to say we're in a pandemic, people. Let's just try everything and see what works. We don't need randomized controlled trials when people are dying. On the other hand, being in a pandemic is not a normal situation to be in. We haven't really been in a pandemic. At least, my contemporaries. I've been doing this for 20 years, and there are a lot of doctors younger than I. We don't know what is a normal response during a pandemic. So, but to be very specific, the demand for that kind of validated data in a time where no one knew what was going on is not justified, especially when you have like board certified physicians making a statement showing you data. And here's the thing, again, for the audience, and you probably already know this, Joe, is that this wasn't, just some random drug that they pulled off the shelf and said, hey, let's try it. We had research going back decades showing that hydroxychloroquine can safely treat SARS coronaviruses. And we also knew that it had antiviral properties, not just antiparasitic properties, like with malaria, but antiviral properties. So it wasn't some crazy solution. We had history that says it probably does work if we just give it a chance.
Madhava writes, only 4 months into the pandemic, many doctors in this group seem to have largely abandoned their logic and curiosity. Apparently, having a treatment undermines those who had nothing to offer people who were dying. How could so many trained medical professionals unite in a mission to excise dissenters, abandon open inquiry, and devolve into what might best be described as tribalism? Then comes the vaccine. Here Madhava recounts the experience in the group, as well as how the group began to deal with what they felt was vaccine misinformation.
Yeah, so I joined the group right around the time that the vaccines were rolling out. And the reason why I was interested in knowing what other doctors had to say is that I had very, very big questions around the vaccines. Like, why was there so much confidence that these things were going to work? Because the trial data did not demonstrate any rigorous signal that they were working, nor did it appease my fears that there might be adverse events. And, this is something that you and I have been talking about here at the Pulse for over a year, Joe, and nothing was different back then. Like, everything that we've seen over the last year was predictable from the actual vaccine trials that we had access to back in December of 2020. Now, when I joined, I was shocked to see that doctors were supremely confident in the vaccine, despite the fact that we didn't have any good data. There was no real age stratification in terms of which ages benefited the most. We trialed the vaccine on a very, very healthy group of adults, and we didn't observe them for very long. So, we might have some initial success with preventing COVID-19 infections, but we only watched these people for 2 months. Like, how do we know how long it's going to work? How do we know what side effects are going to occur over months? And despite all of this uncertainty, I see an irrational exuberance over the vaccine, which at that time was inexplicable to me. I mean, it was literally, I was shocked.
Yeah. And I think this is also the time where now the public is generally starting to have a lot more conversations around vaccine skepticism, and they're asking questions about stuff. How could this have been fast-tracked? There's obviously some doctors talking online and in different podcasts and different interviews about their concerns, very similar to like what we did together. And this is where the discussion of misinformation sort of comes into the picture, where it's sort of like this question of how do we combat this misinformation? Now, this is an interesting question because there is sometimes misinformation and then there's just legitimate questions. How would you contextualize what was going on with regards to that?
Yeah, well, the distortion was that a question about the vaccine became labeled misinformation. Anyone who said, I don't really trust this, that was immediately attacked as a detractor towards a detractor of public health. So there was a strange distortion of what constitutes misinformation, and that is yet another twist to this whole story. Is when people when doctors were asking, like, how are you guys dealing with your patients that have hesitancy around the vaccine? The almost universal response was, I don't know what to do. I mean, these people they're ignorant, and they're taking risks with public health, and they need to be stopped. We need to stop this at all costs, even though these questions were extremely legitimate. I mean, these questions were exactly the same questions I was asking.
Now, is it because, the way the media presented it, I mean, the way we learned about the Pfizer trials was that, I mean, there's 95% efficacy, and this is what kept getting sort of pushed on, and it seemed like we had this savior, and that it could potentially be like, if we have this severe disease and this is our way out of it, this is our way to end it, that's a thing to be hype on, that's a thing to be excited on. Were doctors trying to protect the fact that this could be over and we need to put all of our eggs in this basket? Were they concerned that patients were trusting their authority? Like, what are some of the layers that you think was going on as to why doctors were so quick to just want to say, no, let's just shut all this inquiry down?
Yeah, that's a complicated phenomenon that we're seeing. I think it's a combination of all of those things that you mentioned. One was a over exuberance around the vaccine, and because it was hyped so much as, like you said, 95% efficacious from the Pfizer trial. There's also it was sort of resounding in the media that now is the time to come together and trust the science, right? So you have that going on, but there's also the final aspect of this is that doctors were pretty much ignorant about the entire regulatory process around emergency use authorization. Yeah, most people, most doctors didn't realize that there were 3 stipulations to emergency use authorization, and those 3 were, you need to have an emergency. You need to have a product that's at least 50% efficacious, and there must be no alternative therapies available, right? And when you look at what had happened during the first 8 months with that knowledge, it is not so hard to see how the narrative was designed to hide that fact from physicians. And this explains why doctors were so quick to jump on hydroxychloroquine as a therapy that's been debunked. If, on the other hand, they're like, oh, wait a minute, if hydroxychloroquine works, then we're not going to get a vaccine. And that's why hydroxychloroquine has to be suppressed as a possible therapy. On the other hand, you could have a doctor to say, oh, they're suppressing hydroxychloroquine as a therapy because they want the vaccine to be introduced. So that nuance to this whole approach was lost on doctors. There was no discussion around that.
Things are about to shift again in the group. While the current sentiment is keen to attack colleagues talking about treatments, those same doctors start reporting a flood of adverse reactions from injections.
Once the vaccine was deployed, adverse events started to occur. And that's what I thought was really fascinating is, we had this huge push towards vaccinate and ignore hydroxychloroquine. And then somewhere in early 2021, when the vaccines were rolling out, doctors in this group started to say, hey, I'm seeing adverse events and I think they're real. And as soon as someone opened that up, there was a flurry of adverse events reported by physicians from their patients and themselves. This is really happening. This vaccine is potentially dangerous.
Just saw a patient, an RN, who received second dose of Pfizer vaccine 3 days ago and that evening started experiencing dizziness, loss of balance, and double vision, which continues through the day. Her husband also has reactivation of his trigeminal neuralgia after receiving first dose of Moderna. I've never had any underlying disorder, but started a new lower lip twitch 2 days after second dose of Pfizer. I'm almost 4 weeks out and still feel it intermittently. I never ever felt that before the vaccine. Some may not think related, but I absolutely do. Has anyone seen slurred speech and word finding 24 hours after Pfizer dose? Went to ER, no stroke, diagnosed with a migraine, now 4 days with same symptoms. Patient had COVID-19 in July 2020. Saw a male who had petit mal seizure 2 weeks after first dose of Pfizer and no other changes whatsoever in routine or diet or exposure or meds or supplements. Had 2 days of the reactivation of the thoracic shingles neuralgia I had 3 years ago. Have a patient who developed neuralgia at the thoracic region the next day after receiving first Moderna vaccine. Suspected shingles, but no rash has appeared and has followed one dermatome. Now they are 2 weeks out and still having the pain. I personally had dizziness, loss of balance, and double vision with both my shots. Worse with the second within 20 minutes of the vaccine. One hemorrhagic stroke. Local physician died, hospitalized with a few days and never left alive. Myocarditis and another with pericarditis and pleural effusion. My list goes on, and yes, I have reported to VAERS. It is time consuming and not purely passive, as they have also contacted me on cases.
I only listed a fraction of them because there were too many. Now we had doctors reporting that they were seeing adverse events in their patients, as opposed to in the past in this particular group, where someone was expressing a cautionary perspective and was not being acknowledged and was being attacked. Now doctors, one after the other, were like, I'm seeing it, I'm seeing it, I'm seeing it. This guy has Guillain-Barré syndrome. This other person had a stroke. My lips are twitching and it's driving me crazy. I don't know what's going on. I've got shingles. And this begs the question then, why wasn't this being reported publicly? It was, it was being discussed privately amongst physicians, but not publicly. And, it begs the question, what should have been done at that time? And you can see, honestly, like, I'm trying to be as fair as I can. And again, I want to say that, doctors aren't trying to hurt people, but they're humans and they're not always rational. So I would say that they're like, well, these things happen, but we have a bigger problem. And so, Joe, this is another aspect of this. This is another sort of distortion, is that there's an overriding sense amongst the physician community, at least this one, that because the virus or the disease is bad, that means the treatment must be good, which is irrational. Those are two separate things, completely separate things. Just because you have a bad disease doesn't mean the pill or the shot is going to work. But somehow doctors lost their bearings in terms of pure logic.
Madhava writes, despite the dozens of documented adverse events coming from this group, this next doctor still urges a unified voice around the science. Big picture, confirmed US deaths from COVID, 441,000. Confirmed US deaths from COVID vaccine, 0. For people wanting to wait or saying pick your poison when it comes to COVID versus the vaccine, I sincerely hope you aren't saying these things to your patients. The science on this is quite clear, and the medical community must speak with one voice. We believe the science, we believe the evidence, and we have faith in the data. So the question, we were doing our best with what we knew at the time. Where in this story might that statement become, I hate to use it this way, but almost like unforgivable? Like, where in that story can we say, but hold on a second, at some point we did have the data. Does that play into this?
When doctors are seeing adverse events being reported in their own community, the fact that all they would say is, well, let's report it to VAERS, and we don't really want to talk about it because people might get scared to take the vaccine. That's an irrational perspective. I mean, we should have been, as physicians, saying, holy cow, we're seeing adverse events. Can we stop and look at this more closely before we just uniformly say everybody must get vaccinated.
Then one doctor in the group asks a very important question. My question is, do we really have enough information to properly educate our patients about this vaccine? Seems to me we have gone away from evidence-based medicine and are pushing theory. And this is literally what we've spent the last year doing in good faith, trying to understand what the information and real-world data is saying about this intervention. In the process, we've been called anti-vaxxers, conspiracy theorists, and have had our YouTube channel deleted twice. We wanted to move beyond the vague statements that it's safe and we're not seeing any widespread problems, to asking, how do we know this? Especially given the amount of adverse events you do see when you start to take a deeper look at this story. To be clear, what asking these questions can lead to is a reasonable understanding around the questions, should I be vaccinated if I'm not vulnerable to COVID-19, given that almost all severe disease is happening in older populations or in people with multiple comorbidities? Given we know the vaccine doesn't do well stopping transmission and infection, should I expose myself to a potential serious adverse event when my risk of hospitalization and death is almost incalculable because it's so small? Does it make sense for me to lose my job, my livelihood, my access to travel, my relationships with friends and family? These are all questions that people were asking as they were trying to make sense of the data. And to understand the data a little bit more clearly and the risks associated with adverse events, I recommend you check out this video we published not too many days ago. The process of sense-making was breaking down, and something needed to be done about this. It seemed clear that in this physicians group, groupthink and an echo chamber is what it became. I know by the end of all this, you checked back in with the person who initially invited you to be part of this physicians group, and you asked what her thoughts were on, what she's seen happen in this group over the course of time. Can you break down her response and how you interpreted it?
Well, she nailed it. I mean, she said, look, I don't even go there anymore because it's an echo chamber. Everyone there says the same stuff over and over again, the same narrative, it's unquestioned. And she's bringing up a vital aspect to this, is that we have echo chambers. That's an echo chamber. And I would suggest, and the point of this piece was to indicate that, yes, you have an echo chamber, but there are a lot of people there that are quietly watching. And unless they speak up, we do not know if we truly have a majority that believes that. And the reason why this is important, Joe, is that this is one of the points that you and I talk about in our masterclass, Overcoming Bias and Critical Thinking, is the presumptive legitimacy of the majority. In other words, we're very, very confident that if most people believe X, then X must be true. And we run into a problem because that's not actually how majorities are formed. That would be true if everybody, if 60% of the people vote X is true, X is probably true, as long as all of those 60% of the people did their due diligence and researched the topic. If they came up with that conclusion independently of each other, it's probably going to be right. But in most situations, the majority is made up of a minority of people that do the research and say, yeah, this is what we found out. And because they have a degree after their name, or they come from an institution, or they have the New York Times, under their belt, people just say, oh, that must be the right answer. And so now you have a majority, but only a minority of people have actually came to that conclusion. So that is one of the major biases that we have here that's derailing this. The other real bias here that I'd like to bring up that we talk about, you and I, is when you have a conclusion, when you have data that supports a conclusion that you don't believe from the very beginning. Like, for example, if you have all this, if you don't believe that hydroxychloroquine can cure a disease that we've been told is incurable unless we have a vaccine or whatever, then all the data that supports it, you just discard. It's like, I actually can't believe that this medicine could solve the pandemic. Therefore, all these studies, they must be bunk. So that is the problem we have with large paradigm shifts, is that the presumptive legitimacy of the majority, and then we have the dismissal of evidence that suggests a conclusion that you're unwilling to believe. So I think both of these things are in play right now in the pandemic response. We're in a very, very tight race right now because we have authority coming down on the public and on physicians. Physicians are losing their licenses for speaking up. If this continues, then we will not know if we truly have a minority of dissenting opinions or a majority that is too afraid to speak up. If that is actually the case, we have to think very carefully about what this means. If the majority of physicians actually believe this is a mistake, but can't speak up, that means we have an authoritarian regime that is dictating what is and what isn't. And this is why it is absolutely important to protect our physicians and the right to speak up, and scientists. Even if you disagree with them, you have to let them speak, because otherwise we're never going to know. We could be stuck in a Orwellian kind of science dystopia where we don't know what actually is and what isn't. Science itself requires us to let all positions and opinions be heard. If we don't have that, then let's stop calling it science.